So what would be the most important, simplest tips that I can just, let's say, report from memory, from experience after 30 years of practice? What helps the most? Well, completely excessive, brutal toothbrushing, overly aggressive oral hygiene isn't necessarily an advantage. I'd highly recommend making sure that the quality of the dental restorations is good. Keywords: tight restorations, good filling margins, good crown margins. Then you should definitely ensure that the biocompatibility of the materials used is as inert and optimally biocompatible as possible in the long term. So the best things here are really optimal ceramic restorations. Maybe just briefly, the best thing, of course, would be your own healthy teeth. We've covered that in other posts, how to achieve that optimally. I'm assuming a more statistically realistic situation now where you don't necessarily have perfect, unrestored, virgin perfect teeth. Most people don't have that. They have some restorations, crowns, implants, bridges, and so on, maybe even removable dentures. Let's assume this more statistically normal situation. So what's it about? Use maximally biocompatible dental replacement materials. So, keyword ceramics, optimal quality. Poor quality is really saving in the wrong place. So you really have to make sure the quality is right. Then make sure that periodontitis is treated as much as possible. So periodontitis is always bad in every phase of life, maybe especially during menopause, because additional contributing factors come into play here. Also gum inflammation, burning mouth syndrome, and so on and so forth. Then please ensure optimal salivary function, meaning drinking enough, and the nutritional balance is also very, very important. So enough omega-3 fatty acids, enough healthy fats, enough fiber, and a maximally optimal supply of vitamins across the board. All vitamins must be optimally supplied. Optimal supply of trace elements such as selenium, zinc, and so on. Extremely important for the integrity of the oral mucosa and the mucous membranes in general, but also for the immune system itself. Then also such mundane things as regular vitamin C supply, vitamin D levels are enormously important. A high vitamin D level, either through diet, meaning nutrition, or of course sun exposure at a sufficient angle, are real key factors. If all that fits and vitamin K2 has also been considered, including magnesium, and of course the omega-3 index is optimal. Usually we have to help out here through supplementation, appropriate fish oil, and so on, to simply have an optimal balance in the fat metabolism throughout the body, because we can optimally regulate the tendency for inflammation here and very, very efficiently. So, assuming that everything is fine, then regular, thorough, but gentle oral hygiene is sufficient. This means using rather soft toothbrushes with the correct technique. So, brushing gently but efficiently. That's where the tricky detail lies. It's very, very important. Not overdoing it, and certainly not using toothbrushes that are too hard. And very important or very good is, for example, oil pulling, meaning with, for example, coconut oil, but also olive oil, linseed oil, and so on. Regular daily, even multiple times a day, oil pulling instead of excessive toothbrushing is a super simple and also inexpensive mechanism to improve the integrity of the mucous membranes, because of course oil not only binds toxins but naturally also places a certain protective factor on the mucous membranes, gums, but also on the hard tooth substances, meaning tooth enamel and dentin, and simply reduces the susceptibility to inflammation, burning mouth syndrome, redness, immunological imbalances, and even mundane things like gingivitis, periodontitis, but also cavities. So it's super effective when used regularly for many problem factors, killing many birds with one stone, so to speak. And of course, as mentioned, optimally compatible materials. What's rather bad is, for example, having different metals in the mouth. A gold alloy here, another alloy there, an amalgam here, another immunologically questionable metal in the restoration there. These are all very, very negative things that naturally bring many immunological problems with them. Fundamentally, during menopause, one is of course particularly vulnerable, so really neutralize these things if possible with moderation and purpose. Sometimes, of course, less is more. One has to see how to get the oral cavity immunologically neutral in the most relaxed and efficient way. Of course, modern ceramic implants are the optimum in the field of implants for people who need them, as far as immunological properties are concerned. That doesn't mean that all titanium alloy implants must be a problem per se, but experience shows that problems and peri-implant inflammation do occur relatively often, because not only is periodontitis a huge problem, but peri-implantitis is ultimately present in, depending on how the studies are designed, half of the implants after 5 to 10 years in some way with peri-implant diseases, so relatively unfavorable, strictly speaking. And we've often explained what consequences that has for the entire organism and for the overall aging properties. Inflammaging is the decisive keyword here. And what's also important as a key take-home message, or what can be done concretely? Yes, regular professional checkups with your trusted dentist. Simply see where the weak points are, where the problems are, where a cavity might have been overlooked, where there are inflamed gum pockets. Because, of course, periodontitis usually doesn't hurt, and that's why it mostly progresses chronically, silently, and unnoticed. And of course, a major warning sign is always bleeding gums. If this occurs, always go to your trusted dentist in good time to have it checked out and find the source of the inflammation so that it can be treated optimally and promptly. And of course, this also changes depending on hormonal situations, including during menopause. There are phases where there's a stronger individual tendency towards inflammation, and there are phases where it's less inflamed again. But detecting weak points in good time is truly an absolutely essential and elementary part of preventing more significant consequential damage from happening. Because as I said, silent inflammations are, well, they're called silent because they don't hurt. And periodontitis is a silent inflammation par excellence with many negative effects on cardiovascular health. And especially when you consider that during menopause, hormonal changes naturally contribute to many other increases in the risk profile. As we've said, lipid metabolism is negatively affected, endothelial function is negatively affected, and so on and so forth. And all of this plays together here, making it all the more important in this phase to treat the causes of periodontitis and peri-implantitis. And yes, of course, it's also about nutrition and supplementation. But all of this works together. And we have to adjust all the levers so that the clock, so to speak, ticks correctly.